Good morning, Puan Saliza and my fellow classmates. Today is the second day for the Young Doctors Forum. I am Devjit Singgil and I am joined here by Adib Harith.
Okay, presenters for today are Dayanku Zairin, Shrida, Hazira, Aisha Alia and Shobana.
We will start off with our first young doctor, Dayanku Zairin. She will be talking about stomach ulcer.
Hi, Assalamualaikum. So today I will be talking about stomach ulcer. So what is stomach ulcer? Stomach ulcers, which are also known as gastric ulcers, are painful sores in the stomach lining. And stomach ulcers are a type of peptic ulcer disease. Peptic ulcers are any ulcers that affect both the stomach and small intestine. And stomach ulcers occur when the thick layer of mucus that protects your stomach from digestive juices is reduced. This allows the digestive acid to eat away at the tissues that line the stomach, causing an ulcer. So the symptoms, the causes for stomach ulcer ni ialah untreated gastritis, macam kalau ada gastric and tak treat dia, macam tak makan ubat ke apa, dia akan bagi reason kenapa stomach ulcer tu ada. And smoking, Helicobacter pylori bacteria, and Helicobacter pylori bacteria ni dia bakteria yang duduk dekat bahagian digestive punya sistem. And bakteria ni after years dia duduk dekat dalam tu, dia akan cause stomach ulcer. So itulah sebab dia. And pain relieving macam non-steroidal anti-inflammatory medications and stomach cancer. Stomach cancer ni untuk orang yang lagi tua, and orang yang ada stomach cancer ni dia boleh dapat stomach ulcer. And symptoms dia ada nausea dengan muntah-muntah, and heartburn, which is burning sensation in the chest, and not wanting to eat because of pain, sebab pain dekat abdominal punya area, so dia rasa tak nak makan, and dull pain in the stomach. And risk factors dia consuming medicine such as potassium chloride and non-steroidal anti-inflammatory medications and oral corticosteroids. Non-steroidal anti-inflammatory medications ni dia jenis ubat yang reduce the pain, and also macam ubat-ubat yang untuk sakit rasanya. So doktor ni tak elakkan lah. And for prevention, we avoid alcohol, sebab alcohol ni dia tak bagus untuk badan. So kalau consume alcohol masa ada stomach ulcer, dia akan buat lagi stomach ulcer tu lagi teruk, and dia punya healing process tu lagi lambat nak healing. And meet doctors if you have stomach ulcer symptoms. Ini untuk elakkan daripada stomach ulcer tu lagi teruk lah. And manage your stress. Sebab stress tu one of the reason why you have stomach ulcer. And for treatment for stomach ulcer, consume antibiotic medications to kill Helicobacter pylori such as amoxicillin, biotine, and Tindamax, and also medications that block acid production and promote healing. Prevacid dengan yang dah itulah type tu. And then ada QR code untuk tengok laptop pasal doctors yang cakap pasal stomach ulcer. Itu je.
The most common causes of peptic ulcer disease there are two. The pain drugs that we are taking for arthritis, or these are your pain medications including your aspirin. Plus, it is associated with Helicobacter pylori infection, which is a bacteria that resides in the gastric lining.
As with other diseases, peptic ulcer may lead to further complications, such as possible infections, internal bleeding, and scar tissue.
Peptic ulcer can lead to death, especially in complicated type of peptic ulcer. And then sometimes also cancer in the stomach can also present as ulcer.
Medical experts suggest that the best way to protect yourself from peptic ulcer is to avoid vices such as drinking and smoking and be extra cautious in taking certain medications.
Thank you so much, Dayanku Zairin. I definitely learned something from that.
Without further ado, I would like to welcome the next presenter, Shida.
Srida, you can start now.
Okay, sudah. Continue. The stage is yours. Please proceed.
Teacher, he has a technical issue, teacher. Yeah, he said carry on first.
Okay.
Okay, we proceed with Hazira.
Okay, I'll start. Sorry. Okay, so hemorrhoids. What is hemorrhoids? Hemorrhoids are swollen veins in the wall of the rectum and anus that can be caused by too much pressure in the vein. Hemorrhoids can cause pain or bleeding. So as you can see in the diagram, there's two types of hemorrhoids, internal and external. The external hemorrhoids hurt more as they occur in the sensitive anal region and can cause and because they are exposed to external friction, they can also become itchy, irritated, and painful. But internal hemorrhoids are known to be more severe. So what are the causes? Being overweight is one of the causes. So orang yang overweight have higher chances of getting hemorrhoids because having excess weight boleh create pressure that constricts the blood vessels surrounding the anus and rectum, and that will cause the vein to swell, therefore lead to hemorrhoids. In pregnancy, as your baby grows, your uterus also gets bigger and begins to press against your pelvis. This puts a lot of pressure on the veins near your anus and rectum and also can become swollen. So you may ask, how can lifting heavy objects can cause hemorrhoids? Well, orang biasanya bila nak angkat berat, they hold their breath and strain as they lift the heavy weight. Holding your breath and grunting will force the air down into your lungs while increasing the pressure on your internal organs that thus creates the veins near your rectum to swell into hemorrhoids. Constipation, when you're constipated, you're more likely to push hard to go. This can make the vein around your rectum swell and thus lead to hemorrhoids. Last but not least, diarrhea. Sitting for long periods of time on the toilet because of diarrhea is also one of the causes. So some of the symptoms is painful and swollen lumps in the anus, bleeding from the anus or rectum, pain when passing stool, mucus in your rectum, and itching. Treatment, sclerotherapy, which I'll explain later on, using topical treatments like over-the-counter hemorrhoid cream, and soak regularly in warm bath or sitz bath. So sitz bath is like a shadow bath for your hip region to relieve pain and discomfort dekat vulva, scrotum, and rectum. So lastly, you can also take oral pain relievers to relieve the pain. So prevention, you can eat high fiber foods, go to the toilet when you have to and to not wait, drink a lot of water, and stay active. So what is sclerotherapy? Sclerotherapy is the injection of a chemical solution in the area around the hemorrhoid, resulting in a scarring reaction, which makes the hemorrhoid gradually shrink or shrivel up over time. It is typically reserved for grades 1 and 2 internal hemorrhoid. So grade 1 is, if I'm not mistaken, is like a smaller hemorrhoid, and grade 2 is like a bigger hemorrhoid. So that's it. Thank you.
Thank you to Hazira for the interesting talk. Is there anyone that would like to ask any questions? Okay, Jasmine asks, how long does it last?
Biasanya can last for up to 1 week. but it will take a few weeks for the lump to completely go down.
I hope that answers your question. We would like to proceed with Shrida.
Right. Okay. Good morning to Teacher Sariza. My name is Peter from Fondavilla. Today I'll be talking about constipation. So, what is constipation? Constipation is a condition in which a person has uncomfortable or infrequent bowel movement. Causes of constipation is medication. Why medication? Because the drugs relax the smooth muscles in the blood vessel to lower the blood pressure and also relax the muscle in the gut, which causes constipation. Other than that, too much of dairy products, mental stress, lack of fiber, lack of fluids such as water, and also after surgery. What are the symptoms of constipation? Few bowel movements, trouble having a bowel movement which is straining to go, hard or small stools, a sense that everything don't come out, and belly bloating. So how to prevent, and basically the prevention and treatment for constipation is just the same. So eat well, balanced diet with plenty of fiber, which a good source of fibers are fruit, vegetables, legumes, and whole grain bread and cereal. Drink 1.5 to 2 quarts of water a day. And then avoid caffeine, it can be dehydrating. Cut back on milk. Dairy products can be constipate some people. Exercise regularly. Do something active for at least 30 minutes a day, and then go to the bathroom as soon as you feel the urge. And why constipation in children? Children most often get constipated from holding in their stool to avoid or delay having a bowel movement. When stool stays too long in the colon absorbs too much fluid from the stool. Then the stool becomes hard, dry, and difficult to pass. Other than that, they also feel stress about potty training. They don't want to interrupt their playtime, and also fear having a painful or an unpleasant bowel movement. So that is all from me. Thank you very much.
Yes, thank you, Sridhar, for the very informative presentation. Are there any questions? Nur Hana Batrisha asked, can it lead to surgery?
Can also.
Any more questions? Okay, if there are no more questions, we'll proceed with our next young doctor, Aisha Alia, who will be talking on anorexia nervosa.
Assalamualaikum and good afternoon, Teacher Saliza and friends. Today I'm going to talk about anorexia nervosa. Anorexia nervosa is quite common amongst teenage girls who are obsessed with their body weight. Anorexic will avoid food to achieve their ideal body weight. They suffer from psychological problems and nutrient deficiency because of their normal digestive system is affected. There are two subtypes of anorexia. Restricting type. Restricting type is they restrict energy intake by dieting, fasting, and excessively exercising, while the binge eating and purging type is they restrict how much they eat, but even though they eat very little, they also try to purge it out by abusing laxative and diuretics. So, sorry. So there are three risk factors for anorexia: is biological, psychological, and societal norms. Biologically, close relatives that have eating disorder increase for someone to develop themselves. People who report a higher level of body dissatisfaction are more likely to suffer from an eating disorder. Our society has projected that someone is better and more attractive if they are thinner. Some messages can cause someone's body dissatisfaction to increase because of this influence with these messages. So what are the symptoms? Self-esteem is based upon appearance and looks, terrified and worried about gaining weight, denying hunger cues and pretending not to be hungry, constantly weighing and checking self in the mirror. So what is the effects of anorexia? is constipation, irregular heartbeat, swollen arms or legs, dehydration, loss of hair, loss of period, difficulty sleeping, dizziness or fainting. So what is the treatment and prevention? There are 3 popular treatment. That is cognitive remediation therapy, CRT, is a very specific type of talk therapy that is designed to help the patient to overcome toxic thought patterns and replace them with new healthier thoughts. One of the core cause of anorexia-related behaviors goes back to the particular set of thoughts. CRT gives patients opportunity to reflect on their thought and emotion. Second is dialectical behavior therapy, DBT. This is type of therapy used often to specifically treat anorexia. The behavior associated with the eating disorder are observed, understood, and then alternate to be more productive and healthier. For treating eating disorder patients, it is important to replace unhealthy thoughts with healthy ones. So lastly is family-based therapy, FBT. For young people with anorexia, FBT can be the most highly effective therapeutic approach. The support and love of a family is incredibly important for recovery, and this is especially true for teenagers and preteens who have an eating disorder. Even for older people who suffer from eating disorder, family support can be the real key to a successful recovery. So how to prevent anorexia to become more worse? They will likely to start showing warning signs of the eating disorder, such as dramatic weight loss, constantly complaining about being fat, avoiding meal times, and excessively exercising. Here are ways you can help them from getting worse. Talk to them, discuss your worries with them, and don't wait until their symptoms become severe. Share your concern with other people who care about them. The sooner you talk about it, the sooner they can get help. Give them support. Tell them you love them. People with anorexia often have a hard time trusting others. Go out of your way to show them that they can trust you. Praise and compliment them. Tell them how wonderful they are and remind them that true beauty comes from the inside. It's good for them to hear that someone thinks they are great just the way they are. Be their role model. Eat and exercise in a positive way. They need to see you practice strong habits. They could inspire them to follow your lead. That's all from me. If you guys have any questions, I would love to answer them.
Puan Liza is asking, is it a mental illness?
Yes. Yes, and yes.
We will proceed with Shobana. Okay. Are you ready, Shobana? The stage is yours.
Okay, good morning. Good morning, Puan Saliza and my fellow classmates. Today, I'll be presenting about bulimia nervosa. Okay, the definition for bulimia nervosa is it's an eating disorder characterized by binge eating followed by methods to avoid weight gain. So basically, bulimia is actually a type of eating disorder. So now, bulimia is actually more common in female between the age of 18 to 35 years old. So you may be wondering, why specifically this age? Because this is the age where people tend to be more exposed to media, and this can lead them to be more self-conscious of their thoughts and their eating habits. So now the question is, what do bulimia patients do to get rid of the calories? There are many methods carried out. One of them is by intentional purging, by misuse of laxatives. So laxatives are basically medication used to treat constipation. So a bulimia patient would take laxatives excessively in order for them to purge the food that they just ate. So this should not be done because your bowel movement is something that should come out naturally rather than forcefully. Besides that is self-induced vomiting. So self-induced vomiting is basically where they take their fingers and put it at the back of their throat. This is for them to vomit out the food that they just ate. Next is misuse of diuretics. Diuretics are medication used to release more urine. So in this case, a bulimia patient takes the laxatives and diuretics excessively in order for them to purge more and urinate more often. you can also say that they do strict dieting, whereby they'll be like, okay, today I'm only going to drink water, and they will do that for one whole day. Other than that is excessive exercising. Exercising is good. However, excessively exercising can do a lot of harm to your body. In this case, bulimia patients will probably be in like the gym for like 6 to 8 hours a day. Lastly is uncontrolled fasting. Uncontrolled fasting is basically where they would go one whole day of not eating any food. So now, moving on, causes. What causes bulimia? One of them is genetics. If someone in the family has bulimia, there is possibility for the next generation to inherit them as well. Besides that is environmental factors. Environmental factors are basically, the people you're surrounded with, your thoughts, your work stress. This can lead you to having eating disorders. Besides that is emotional health. Emotional health, you can say like, if you're someone who has depression and anxiety, this can trigger you to having eating disorders like bulimia. So next, symptoms. What are the symptoms if you have bulimia? One of them is malnutrition caused by this eating disorder. Besides that is hormonal imbalance. Yes, of course, because you're constantly purging or vomiting. Besides that is liver disease. Liver disease is because the fats from your food will not be digested completely, and this can cause liver disease like fatty liver. It's a type of liver disease. Besides that is cardiovascular problems. This happens because of the electrolyte imbalance in your body. If you didn't know, electrolytes are basically used to regulate the rhythm of your heartbeat. So when there's an imbalance there, this can lead to heart attacks and therefore cardiovascular problems. Finally, treatment. How do we treat someone with bulimia? One of the ways is by counseling. Yes, someone with bulimia requires a lot of counseling. Besides that is medication. The doctors would normally prescribe you with antidepressants. Besides that, cognitive behavioral therapy. This is actually a very interesting form of therapy because they would assign you with mind games based on your case. So for instance, if you have bulimia, they would give you activities based on your case, and this can help you prevent you from your thoughts of, binge eating and purging. And cognitive behavioral therapy is the most effective way to cure someone with bulimia. Finally, psychotherapy. Psychotherapy. You are not considered a psycho if you have bulimia. However, psychotherapy is very, very important because it can help your behaviors. Because as you know, someone with bulimia goes to great extents to remove the food that they just ate. So to wrap it all up, I hope this poster of mine can be an eye-opener to everyone about bulimia, its causes and its symptoms. Because if you didn't know, bulimia rates are actually skyrocketing, especially around people our age, teenagers in general. So I actually know someone who has bulimia. She was diagnosed when she was at 15 years old. And let me tell you, it was a very tough phase for her family, although she's doing better now because of going for therapy and stuff. So yeah, that's all. And also thank you, Puan Saliza, for giving us this opportunity to be young doctors for the day. I had a lot of fun doing research about this. Thank you. That's all from me.
Thank you, Shobana. Now we come to the question and answer session. We have Hana with the question, apa beza anorexia dengan bulimia?
Anorexia, someone with anorexia is underweight. However, someone with bulimia, they have normal weight or they can be overweight. So you can tell that someone with bulimia, it's easier for them to hide the fact that they are going through an eating disorder rather than someone with anorexia because it's way more like obvious. Dia lebih jelas lah. Yeah.
Okay, hopefully that answers your question. I will now, this is the, okay, we have come to an end to our forum. I would like to thank our young doctors, Aisyah Halia, Shobana, Hazira, Shrida and Dayang. Hopefully it was beneficial to everyone. Assalamualaikum warahmatullahi wabarakatuh.